Ollie, talk to us about the Queen's speech. So it's an important day, her opening Parliament, sort of setting the agenda for the country. But it must have been quite a difficult day for her.
I think that's right, and much of the attention, of course, was focused on the Queen, given that it was, as you say, her first engagement in public since the death of Prince Philip. She was accompanied by her son, Prince Charles. He's done that before, but we do expect that we will see more of this in the future now that Prince Philip has passed away. Even though he had really stepped back from frontline royal duties in the last few years, we do understand that senior royals are now likely to accompany the Queen on most, if not all, of her public engagements now. It was a pared-back affair. It's normally the Queen's speech, the state opening of Parliament, an affair that is full of pomp and ceremony. She would come to the Westminster Palace in a carriage. There would be hundreds of MPs and lords all in their finery. This time around, she came in a Range Rover. There were far fewer people than there would normally be, because there are still COVID-19 restrictions in place here, even as the country moves out of lockdown and moves through the Prime Minister's roadmap away from COVID-19 restrictions. But as I say, a lot of attention focused on the Queen as a result of the death of Prince Philip, and she delivered the Queen's speech much as she always does, without giving anything away in terms of what she thinks of any of it. This is a legislative agenda for her government that is written for her. And so sometimes you have these odd turns of phrase that are government slogans that come out of her mouth, but you know that she hasn't written the speech herself. She is simply delivering what her government says it is going to do over the next year or so.
All right, so tell us a little bit more about those priorities. And I suppose chief among them is Boris Johnson talking about easing the lockdown.
That's right. This was very much seen as a post-COVID Queen's speech, or at least an agenda for the post-COVID period that Britain hopes it is now heading into. Because of the success of the vaccination rollout here, we now are seeing daily fatalities just in terms of a few each day, and cases are very, very low, prevalence is low, hospitalisations really at very low numbers as well. And Boris Johnson has confirmed that from next Monday, the 17th of May, England will move into a more relaxed period when it comes to restrictions. So indoor hospitality is going to reopen. You can have parties of up to 30 people outdoors. You can have indoor household mixing again. Cinemas will reopen. And all of that is because Boris Johnson and his scientists say that the data continues to very much move in the right direction. And so this is a post-COVID recovery plan that the government is putting in place now. We heard lots of talk about spending on infrastructure projects, on training, on reform of the healthcare system. This is all about the government trying to set the agenda for what comes after the pandemic period. Nonetheless, the opposition Labour Party said it was unambitious, there wasn't enough in it, and very critical of the agenda that the government has set out. But the picture that Boris Johnson is trying to paint here is of a united country moving out of a pandemic and with a government that has a plan in place to keep the economy really growing at a fast pace now as things start to reopen.
So here in South Africa, we're really worried our infection rates slightly ticking up. We're worried about a third wave, but the UK is going to avoid a third wave thanks to the vaccinations. Is that right?
That's what scientists currently believe. Even a few weeks ago, there were scientists advising the government, really worried that if enough people didn't take up the offer of a vaccine, we would see a wave over the summer or perhaps in the autumn, the British autumn, that would be potentially quite large and would lead to a large uptick in hospitalisations and deaths. The data from the vaccination rollout programme at the moment now leads UK government scientists to believe that the next wave shouldn't be significant and, crucially, shouldn't lead to a large jump in the numbers of hospitalisations and fatalities. That's because not only are so many people taking up the vaccine, but also the data is showing that the vaccines really do cut the risk of hospitalisation and death, but also, crucially, cut transmission as well. So all the attention now in the UK is really going to be focused on making sure that that vaccination programme continues at pace and that people continue to take up the offer of vaccinations so that we don't run the risk of a significant third wave of coronavirus here.
Thank you so much. Ollie Barrett, our correspondent in London.